With me this morning is Sara Stephens. We're going to talk about something called Developmental Coordination Disorder.
Yeah.
Good morning, Sarah.
Hi, Carrie. Happy New Year.
Happy New Year. Yeah, I know, right?
Happy to be back.
Glad to have you back, definitely. So, Developmental Coordination Disorder, what is it?
So when we talk about developmental coordination disorder, we have to first start with what is motor and motor skills. As occupational therapists, we talk about motor meaning our movement in our body. So gross motor are our big muscles. Those are what we use to walk and move.
Right.
And fine motor are our little muscles, kind of what we do to button a shirt. And as an OT, we'll work with kids who struggle with some of these motor coordination issues because when you have those motor problems, it can affect the motor planning piece, and then it can affect their activities of daily life, or their occupations. So occupations for kids, as we said before, are play, school, basic self-care skills. So when motor planning is a challenge, it can affect those successful skills in those areas.
You said the term motor planning a couple times there. Tell us a little bit more of how motor planning affects a child.
Sure. So motor planning is doing an action with intent. And there's three basic parts to motor planning. So we start with ideation, like knowing what you're going to do, orientation, getting your body organized and ready to do it, and execution, so actually doing it. So if we look at like jumping rope, the ideation is you're going to jump rope. That's the plan. Right. Orientation is you get your body lined up, your feet forward, your hands by your side to hold the rope. So you're your body's in position, and then the execution is you actually swing the rope. So you need to make the motor planning pieces that we're jumping. It's all parts of that, but the idea that you're jumping as the rope comes to your toes, not early, not before it comes to you, or not after it hits your feet.
Right.
So that's the motor planning. And what we see with some of our kids is that they struggle with some of those more higher level motor planning activities. So like tying shoelaces, which is something that we all take for granted. Once we learn it, it takes a little bit to learn, but once we learn it, we have it. Or riding a bike. We think, okay, riding a bike, you put sit on the bike and go, but there's a lot more to it. And when kids have kind of a constant struggle with some of these tasks, that's when they might need to come and have an occupational therapy evaluation and treatment to work on what we call developmental coordination disorder, or dyspraxia.
Dyspraxia, that sounds like a big word. What is dyspraxia?
Well, I use it kind of interchangeable between developmental coordination disorder and dyspraxia. It really depends. It's a diagnosis depending on which country you're in. Different countries, but it means the same thing.
Okay, so how serious is it?
Well, it affects, right now I think the latest stats I saw, it affects about 5 to 6% of school-age population, early primary school population. And what we see is these are the kids that maybe like handwriting, they're always struggling with handwriting. They try, the parents are getting frustrated. The teacher constantly says, it's not neat, I can't read it, even though, they're able to focus and pay attention, but that motor control is so tricky. And so when we get a child who really struggles in that area, it could be also that these kids come to us and their parents are like, yeah, they've always kind of been a clumsy kid. They're a little awkward, or they don't really like to participate in sports or team sports because they've always been kind of tricky for them. Those are things that we see with these kids with dyspraxia or developmental coordination disorder, because it's those three pieces that ideation, orientation, and execution of a motor task that the kids are struggling with. So at that point, if it's something, parents get really frustrated, kids get really frustrated because it's something they've been trying. So they've been trying to learn to tie their shoes, but it's been going on for a month. So tying shoes takes a while. You teach a 6-year-old how to tie his shoes and they're not going to get it overnight, but they should figure it out within a couple days. But if it's been a month and every day they're practicing tying their shoes and they're struggling, that's when the intervention with a specialist might be warranted. Okay, so it's not something that should be taken lightly. If as you said, like parents may just say, oh, the child may be a little bit awkward or they're a little bit clumsy, so that. If it's something that is prolonged, it's not something that they should take lightly, and they probably should see an OT. Yeah, because you can imagine when things are hard and difficult, you can get frustrated, and then that can affect all your mental health and your desire to try and push through those hard things. Because it's one thing they say, if you're not great at a push-up, you keep trying the push-up, and after you do push-ups every morning for 7 days, you're much stronger. But our kids would be trying to do these motor activities, and as much as they're trying to do it, it still is challenging for them, and they're still really struggling to be able to do certain tasks and certain actions.
All right, so what does an occupational therapist do to help?
So kids come once they've been identified as having developmental coordination disorder or dyspraxia. We'll do an assessment, we'll look at their motor skills, and from there we'll bring them in. And what occupational therapists, because one of the occupations is play, a lot of times I think people look at our therapy sessions and think, oh, we're just I'm paying for my child to go play.
To go play, right.
But we're using very specific tasks. And
Okay.
kids come to OTs and occupational therapists, and we have what we call an occupational therapy gym or a sensory gym. And now, I mean, I know you know about gyms.
Right.
Our gyms look a little different than maybe the gyms that you go to
yeah.
every day. So our gyms, we have, it looks like Playland, really. We have scooter boards. At Therapy Works, we have scooter boards. We can go up and down the hallways. We have trampoline and crash pads. We have special swings that are like Lycra swings. The kids they're hung from the ceiling. The kids climb through that to get body awareness.
I want to ask you one more important question. What can parents do with their kids, like, just at home?
Sure. So if they're kids that are not needing the direct intervention, or if you're not quite getting to intervention yet, you want to give them opportunities to build, as working on building this motor planning, we want to give kids, that's what the purpose of having the sensory gym too, is we want to give them opportunities to do a certain motor action over again in a specific way. So if you can do it over again, you can build that motor memory and develop the motor skills. At home, I tell parents, take your kids to the park. The playgrounds are the best places. You can get on the monkey bars. I was never great at monkey bars, but you can think of all the motor plan that takes to swing your body through to grab the monkey bars.
Okay,
you
so
could
just
do
simple things like that.
Kids love Ninja Warrior, Warrior Ninja on TV. You could make up a course on the playground. Wheelbarrow walking, jumping and climbing things. Those are all great things.
Simple things that you could just do at the park, do at home and stuff like that.
Yeah.
All right, Sara Stephens, from occupational therapist from Therapy Works, thank you so much for joining and sharing this morning, because I know it's important information that, is speaking to a parent out there. And it's important information for those who may not be able to come see a therapist, to just at least get something to work with.
Perfect, yes,
all right,
exactly.
So thanks a lot, Sara.